Now, brief history of drug development, we saw a golden era where we saw a lot of alchemy that is search for longevity and vitality potions. This has started from the land of Arabs. Then we have seen Greek, Chinese, and Arab medicine. We have seen treatises and diseases and treatments written by a lot of famous personalities. We have seen Tibb-e-Islami or Tibb-e-Islami. Now, these two things I have highlighted because this is what I want to correlate later on with my presentation when I tell you how modern medicines are developed. The unique features of this era was that there were a lot of successes. So none of the doctors like me who have done their MBBSs and MDs and who are selling modern medicines, none of us are saying that the traditional medicine, the medicine of the yore, had any deficiency or they don't work. No, they work. They work fantastically well. My own mother was a patient of tuberculosis about 2 years before I was born. This was told by me to my dad, by my father. So I took her, when I joined the medical college and when I was in my MD, I took her to the medical college, I got an X-ray done and I could see a scar of tuberculosis in her chest, which meant that it was a healed tuberculosis. And what did she take? At that time, there were no anti-tubercular treatments available in India, and she was living in Varanasi, which was at that time a very small ancient town. She took treatment from a famous Hakim at that time, Hakim Kazim Sahab, who gave her some concoction which included some kind of a trap or a scorpion thing that he did that my father briefly remembers. So that means that it works. And we have thousands of anecdotal evidences that it works. But the problem is that Hakim Sahab, who is no more, his son did not follow the line of hikmah, he is something else. And when I went to him to ask him that what was that treatment? It's $1 billion treatment. Overnight I can own a plane, I can own a yacht, I can own a house, whatever I want. Because I will have a tuberculosis treatment that can treat tuberculosis in 1 month. He took me to his basement, which had more than 5,000 books, and he said, search it for yourself. Now that is an evidence, that is the good thing and the bad thing. The treatment is there, but its record is nowhere. It is transmitting from heart to heart. Next slide, please. Then in the 20th century, we did all the modern medicine that came about. It was still mainly targeted at treating the symptoms. Somebody has diabetes, lower the sugar. Somebody has headache, treat the headache. Somebody has cancer, kill the cells. Still, we have not yet gone to the root cause of the disease. Next slide, please. In the modern phase, we started with understanding the basic cause of a disease. Why is a disease caused? Then we targeted the cause of that disease. Then, next point please. Then we did drug designing based on the knowledge of these mechanisms. Then we fused pharmacology, biotechnology and information technology, and that is how we came to the basic conclusion. Now this is a very small, I'll very quickly give you this example. This is one of the main causes of cancer. This is the root cause analysis of cancer. There is a receptor, there is a cell membrane you are seeing, there is a receptor outside, and there are some cell induction mechanisms inside. Now when, play it once please. When this molecule, which is called EGF or TGF alpha, when this binds, next please, there is some signaling into the DNA of the cell, next please. And there is a cascade of reactions. And that cascade of reactions is proliferation of cells, growth, uncontrolled growth of cells, cell survival increases, angiogenesis happens, metastasis happens, and people get cancer. This is to the level of depth that we have gone into understanding the disease called cancer, for which even today we don't have 100% cure. We can treat about 40% of the cancers, we can control about 70% of the cancers, but the remaining 30%, especially the ones that are advanced, we have no control on. So that is what we have done. We have gone into this depth, and what have we come out with? Press it once, please. We have these antibodies that go and bind to that receptor. Once they bind to that receptor, this whole process gets nullified. Once more, please. We also have what we call tyrosine kinase inhibitors. They block the next stage, and that is how the signaling is prevented, and that is how we control the disease. These are the molecular diseases that we are controlling by going deep into the molecular mechanisms of diseases. I don't want to teach rocket science here, but this is how modern science works. Next, please. We can go to the next, please. So what we are looking here is evidence-based medicine. Very quickly, please click several times. So this is how an idea becomes a drug. We identify the disease, we locate the targets, we verify the targets, we do it on the hot lead, on humans, and finally the drug is ready for prescription. But here is the problem. For every 7 million molecules that we start with, we get one drug. And this whole thing costs $1 billion. And $1 billion, just to translate, is something that is equivalent to 5,000 crore rupees for one drug. Next, please. Please, we will skip this slide. In conclusion, what I'm trying to tell you is that the basis of modern medicine is based on evidence-based medicine. The previous slide that I skipped, what it basically showed was, can you go back please once? It showed how a modern scientific study is conducted. It's not an anecdotal evidence. It is not what I just told you, my mother got well. Well, it could be a placebo response. It could be that her immunity became so strong that she reacted to it. So how is modern science? How do we come to know that this drug is good for diabetes and this drug is not good for diabetes? It is done by something that is called a randomized, double-blind, placebo-controlled study. What does it mean? Randomized means you don't know whether a person is going to get drug A, drug B, or placebo. Placebo is nothing but a sugar pill, which doesn't have any action. What is the meaning of double-blind? Double-blind means that the doctor or the patient doesn't know what the patient is getting. So let's say half the patients are going to get a drug, half the patients are going to get placebo, which has no effect, a sugar pill. And that is how we are going to study. And these people are all blinded. They don't know whether Mr. X is getting drug or Mr. Y is getting drug or who is getting placebo. When thousands of such patients, half of them receiving drug, half of them receiving placebo, they are given that medication. At the end of that exercise, the data is analyzed. And still people don't know. All that they know is that those on therapy A responded to the treatment, those on therapy B did not respond. And then it is unblinded. Then the magic is revealed. Which one was drug, which one was placebo. And if the drug does better, then it is approved. If it doesn't, then it is not. Next slide, please. So the conclusion, the need is to use the knowledge that is locked within our treatises, within our books, within whatever has been transmitted to us in different form of books. The hidden treasures need to be evaluated for the pearls of wisdom there is. What we need to do is we need to put the spectacles of science on it, and we cannot just ignore them. We cannot feign that we are disassociated with them, and this requires collaboration between modern and traditional scientists and even theologians. In my role as the head of R&D in Sanofi, I am constantly on the lookout. It's my job to look out. Please ignore this slide. It's my job to look out for good new molecules that can be translated into medicines. So if any of you are doing research, any of you think that you have a molecule that basically can be used as a drug, that can treat diseases, then please, I would be happy to talk to you during lunch. I will tell you how to develop them into modern medicines, whether they are from your traditional Tibb, or they are from Chinese acupuncture, or they are any other cultural or whatever medicine. We can do that. That is very much possible.
Going to conclude the session. All the delegates and requested to sharing of experience, which I would like to share. The thing is that
A stroke is a cerebrovascular syndrome and a life-threatening brain injury due to the pre-existing disease or arteriovenous malformation. In India, about 7.5 lakh people suffer from this disease each year, of which one person suffers a stroke every 3.3 seconds. Now you can assess the seriousness. More than 70% of stroke survivors remain vocationally impaired, or more than 30% require assistance with daily activities. So it is important to have a brief idea about a stroke, which makes people's life miserable and dependent all of a sudden due to their uncontrolled pre-existing diseases and illness. Presenting symptoms are sudden onset of moderate and severe headache, nausea, vomiting, visual disturbance, difficulty in speech and facial deviation with limb weakness, seizures, drowsiness followed by unresponsiveness. This is the presenting symptom. If you see any person with this problem, you can assess. Type of a stroke, it is basically two types: ischemic stroke and hemorrhagic stroke. Ischemic stroke is due to the lack of blood supply to the brain, causing ischemia of the particular area of the brain which is supplied by a particular artery which supplies that area. It includes about 80% of all strokes. It can be thrombotic stroke or embolic. Thrombotic, due to the arterial atherosclerotic diseases, means thrombus formation within large and small vessels in the brain. For example, plaque formations within the vessels like anterior cerebral artery, posterior cerebral artery, and middle cerebral artery. Embolic stroke, due to the plastic material symboli thrombus formed in the extracellular vessels and in the heart. It may cause intermittent obstruction of blood flow to different area of brain, which reaches through the supplying arteries to the brain. Thrombus or emboli formation, like in arch of aorta, vertebral artery, carotid artery, and of course due to the irregular heartbeat, recent MI, myocardial infarction, and the vulvar heart disease, rheumatic heart disease, associated with prosthetic valves and endocarditis, infective conditions. Hemorrhagic stroke, it happens the second type. The first is ischemic stroke, second the hemorrhagic. Hemorrhagic stroke is basically due to leaking of blood in the brain. It is about 20% of all cerebral strokes. Like intracerebral bleed. Bleed within brain due to the small and deep vessels rupture, like in cases of hypertension and cerebral amyloid angiopathy. Subarachnoid hemorrhage, due to leaking of blood in the covering of the CNS, which are filled with cerebrospinal fluid, like intra-aneurysmal rupture. 80% cases resulting high rate of death or complications due to subarachnoid hemorrhage. The risk factor of the strokes